Hey guys, I wanted to check in today because there have been several people that have emailed me over the last couple weeks about what the first trimester ultrasound is all about. Specifically, what is an NT? Like if you see an NT that's measured on your first trimester ultrasound, what exactly does that mean? So the NT is a component of the first trimester ultrasound called the nuchal translucency. That's what it stands for, NT. That's just the thickness on the back of the baby's neck. We look at that in the first trimester between 11 weeks and 0 days to 13 weeks and 6 days to see if the baby is at an increased risk for having chromosomal abnormalities. That nuchal translucency measurement, or that fluid that's between the baby's skin line, should be less than 3 millimeters, okay? If it's over 3 millimeters, that can put the baby at increased risk for chromosomal abnormalities. If there's what's called a cystic hygroma, meaning it's pretty much 6 millimeters or more, and sometimes we see like loculated fluid or like septations, lines through that area, that is a cystic hygroma, and that is associated with a much higher risk of chromosomal abnormalities. And if the baby is chromosomally normal, it can also be associated with an increased risk of heart defects. And that's because, heart formation and fluid circulation go hand in hand, and it could cause a blockage of the lymphatic system or fluid that's circulating around the body. So those are the two things that we are alarmed about when we see a thickened nuchal translucency. Remember, that means that that skin thickness, that fluid between the skin line is more than 3 millimeters. So what do we do if it is more than 3 millimeters? Well, we do look for some other landmarks during the ultrasound. We look for the presence of a nasal bone. If we don't see a nasal bone, that doesn't necessarily mean it's something abnormal, but when it's combined with a thickened nuchal translucency, that also heightens our risk of chromosomal abnormalities. We also look at the brain, making sure that the primitive brain, meaning the early brain, is developed normal. We look to make sure that we can see a 4-chamber view of the heart. And we can't see all the details of the heart, but we should be able to tell that there's 4 chambers there. We look at the kidneys, we look at the bladder, we look at the extremities to make sure that the orientation of the joints are normal. Then your OBGYN or MFM physician, which is like me, a high-risk maternal-fetal medicine specialist, would talk to you about doing screening with that. So if the nuchal translucency is thick, you may be offered what's called a chorionic villus sampling, which is basically just a sample of placental cells that we send off for the genetic makeup. Now, 99% of the time, that genetic makeup is the same as the baby's, and that's why it gives us genetic information. There's about 1% of the time where it's not, and that's called placental mosaicism, meaning the placenta and the baby have a different cell line. Your OBGYN or MFM may also talk to you about doing a genetic amniocentesis, which is done after the 16th week. When a needle is inserted into the uterus, we send fluid off for the baby's genetic makeup. That rules out that placental mosaicism, or the 1% chance that the placenta and the baby or cells are not the same. The gene line's not the same. You may also be offered a non-invasive prenatal screen, or abbreviated NIPS. Some people call it NIPT, non-invasive prenatal test, although it's not really a test, okay? It is a screen because it's not diagnostic, because again, it tests placental cells that flake off and enter your circulation, which 99% of the time are the same, but there's a 1% chance that it's different. So the CVS tests placental cells. The non-invasive prenatal screen, which are made by companies called, Natera, Myriad, Unity, it's a blood test that tests placental cells that enter the mom's circulation. Now, don't ask how they got there, because we have no idea. But we know that there's evidence to say that the placental cells do circulate through mom's blood. And so that's why we can do a non-invasive prenatal screen. That test, like I say, is 99% sensitive for the most common chromosomal abnormalities, is a good test. So it screens for Down syndrome, which is an extra copy of the number 21 chromosome, Edwards syndrome, which is an extra copy of the number 18 chromosome. Those with that genetic defect have a high risk of heart defects, and they're also usually smaller babies very early on, and they can also have some other abnormalities. Cleft lip, cleft palate, they can have club feet, they can have abnormal facial features, they can have joint contractures, they can have a lot of findings. And then it also tests for trisomy 13, which is Patau syndrome, most of those babies have major brain defects. It also can give a gender. So because of that, it can tell you if there's an X and a Y, a boy, an X and an X, which is a girl, or 1X, which is a girl with Turner syndrome. And it also detects some other chromosomal abnormalities. Like if there's too many X's or too many Y's, it can give you a risk assessment for those things. But other than those things, the NIPT or NIPS, which is the non-invasive prenatal screen, is not very good at diagnosing or detecting other chromosomal abnormalities, which is why if the nuchal translucency is thicker, your provider will talk to you about invasive testing, because we know that that's associated with a much higher risk of chromosomal abnormalities, and those chromosomal abnormalities can be something other than what that blood test can screen for. If it's thick, there is a 25% chance that nothing is going on with your baby, right? Your baby can still be genetically normal, can still have a normal heart. It's just a risk, okay? And your maternal-fetal medicine doctor, you will be referred to a high-risk doctor if it is thick. They will talk to you about the likelihood of this being a problem, the testing that we just talked about. They'll also talk to you about coming back to do an early ultrasound, look at the anatomy. And in my practice, I do that around 16 weeks, an early anatomy scan. And then if I can't see everything, I bring patients back a couple weeks later for the detailed fetal anatomic survey, which is when we look at everything from head to toe around 18 to 20 weeks, okay? And depending on what the abnormality is that's shown, tells us how frequently we need to see you back, and if any further testing needs to happen. So I hope that helps with what the nuchal translucency is, why we look at it, what it tells us, and what testing can be done if you have an abnormal nuchal translucency. Thanks for tuning in to Pregnancy Pearls. Make sure to click the subscribe button below. And like always, if you have any questions about anything I said today or any topics you want me to cover in the future, please put it in the comments or feel free to email me at pregnancypearls@gmail.com. I'll try to do these a little bit more regularly. At one point I was doing them every week, but now I try to do them just when people ask me to do them at least a couple times a month. So thanks for tuning in. Hopefully we will get to chat again very soon. Oh, and one other thing, I am going to relaunch Pregnancy Pearls podcast. We are going to come up on the next season pretty soon. So hopefully we'll be relaunched in the next couple of weeks, preferably after Labor Day. All right. Hope you guys have a fantastic night. Bye-bye.